Managing Sleep Health. This webinar is hosted by the Cancer Support Community and sponsored by Amgen, Astellas, Lilly, and Tesaro. Today's event is being recorded and will be made available at the Cancer Support Community website at www.cancersupportcommunity.org/webinars. For this webinar, our presenters will be featured first, and then we'll begin the Q&A session. If you'd like to ask a question, please feel free to type it into the Q&A box, which is found on the right of your screen. You may submit a question through the box at any time during the event. At the end of the webinar, you'll be redirected to the post-webinar survey. Please complete this survey as your input is of great value to us. The survey will only take a few minutes. The Cancer Support Community is a professionally led, nonprofit network of cancer support worldwide. We are dedicated to ensuring that all people impacted by cancer are empowered by knowledge, strengthened by action, and sustained by community. On this slide, you'll see just a glimpse of some of the resources and services that we provide. We have our Cancer Experience Registry, which is a community of people touched by cancer. The focus of our registry is on collecting, analyzing, and sharing information about the cancer experience and needs of patients and their families throughout the cancer journey. We also have our Open to Options program, which is a research-proven program that can help you prepare a list of questions to share with your doctor. And we also have our Frankly Speaking About Cancer program, which is our education series that provides information on a variety of topics important to people affected by cancer. Information is available through print, digital publications, online, and in-person programs. If you have any questions on any one of these programs or would like to learn more about the Cancer Support Community and the services that we offer, please feel free to call our helpline, which is listed on this slide, at 1-888-793-9355. Our helpline is staffed by licensed professional counselors who are available to assist you Monday through Friday from 9 a.m. to 9 p.m. Eastern Time. I'd also like to introduce our grassroots movement, which helps ensure that people touched by cancer have access to quality, comprehensive cancer care that includes social and emotional support. If you'd like to join the grassroots movement or find out more information about it, you can visit our website at cancersupportcommunity.org. At this time, I would like to go ahead and introduce our speakers for today, Barbara Lubejko, Colleen Gill, and Marsha Burtis. Barbara Lubejko is an oncology clinical specialist in the education department at the Oncology Nursing Society. She has been an oncology nurse for over 30 years in clinical research and educational roles. At ONS, she develops educational programs and clinical resources for nurses and has a particular interest in evaluating how these programs and resources can help oncology nurses provide the best care for their patients. Barb has also cared for several family members who have received treatment for cancer, including her mother, father, and sister. Colleen Gill is a registered nutritionist and dietitian. She's a speaker and author working with oncology patients since 1990 at the University of Colorado and since 2001 in her private practice. Nutrition Foundation. Colleen is active in the oncology practice group of the Academy of Nutrition and Dietetics. She helped write the first oncology certification exam for dietitians in 2008 and is herself a board-certified specialist in oncology. Marsha Burtis graduated from nursing school at Warren County Community College. She received her BA in sociology from Rutgers University. She worked as a licensed practical nurse in both New Jersey and Pennsylvania and was a substitute teacher for many years. Marsha is a wife, mother, daughter, sister, and aunt. She loves gardening, antiquing, and is a published poet. And at this time, I will turn the presentation over to Barb.
Thanks, Rhea. Okay. It's good evening, everyone, and I'm very pleased to have the opportunity to speak to you. When we speak about sleep health, it's important to remember that refreshing and restorative sleep is key to feeling your best at all times, but is especially crucial for cancer survivors who are undergoing treatment, continuing to heal from treatment, or dealing with ongoing complications of the disease. And sleep is essential to both physical and psychological health, so having difficulty getting adequate quality sleep is a significant problem. And sleep disturbances are considered any change in nighttime sleep that interferes with daytime function, and we'll talk about different types of sleep disturbances in just a little bit. The thing to know about sleep disturbances is that it's not necessarily related to the amount of nighttime sleep you get, but often much more related to the quality of the sleep you receive. And some people do fine with 4 hours of sleep, while others really struggle if they get less than 8 or 9 hours. How you feel is the most important factor in evaluating sleep. It's been estimated that up to 50% of cancer survivors will have some issues with sleep disturbance somewhere in the continuum of their disease, and I honestly would be surprised if it wasn't higher than that. Sleep problems can occur at any age and with any type of cancer, and people with cancer may already have come into the cancer experience already having been diagnosed with sleep disturbances and having trouble, but then these tend to worsen during the treatment. Others may develop sleep difficulties during or after treatment, and for many of these cancer survivors, difficulty getting adequate quality sleep can linger for a long time after treatment. But no matter when sleep disturbances occur, it's important to evaluate the causes and determine how to achieve the best sleep possible for health and recovery. There are 3 major categories of sleep disturbances. Insomnia, which is the most common sleep disturbance associated with cancer, and so I'll be talking more about insomnia in a couple of minutes. People with cancer, though, can also have other issues such as sleep-related movement disorders, such as restless leg syndrome, and also people who sleepwalk sometimes fit into this category, and also sleep-related breathing disorders, most commonly associated with sleep apnea. These other sleep disorders do occur in people with cancer, but usually they're already existent. They're already a problem before the cancer is diagnosed, and other sorts of sleep disorders or sleep difficulties may add on to those. But we're going to focus on insomnia since that's the main issue that most people with cancer identify in terms of sleep problems. So insomnia can look different in different people. So while one person may have trouble falling asleep, another person may have trouble staying asleep. And so insomnia can be trouble falling asleep. It can be waking up frequently during the night. It can mean waking up early and having trouble going back to sleep, or it can be just not feeling rested after a night's sleep. All of these can contribute to daytime sleepiness and other problems, and actually many people have multiple manifestations of insomnia. The other thing about insomnia is sometimes people get insomnia just episodically, not very often. You'll have 2 or 3 nights where they have trouble falling asleep, and then they'll be fine for a while. And then maybe somewhere down the line they may have more trouble again. Other people, though, do have insomnia not all the time, but a little more often. And then there are people who have insomnia all the time. So depending upon the severity of the insomnia, different types of steps might be taken to help to deal with it. But even if you only have occasional issues with insomnia, taking steps to relieve it can be very helpful in terms of your health and coping. So there are many reasons people have insomnia, and I'm going to mostly talk about the cancer-related reasons, but one thing to remember is that people with cancer have a regular life too, and so all those factors really work together to contribute to either worsening or making better sleep problems. On the left in those blocks are primarily things that anybody can have, things like age. Older people tend to have more problems with sleeping than younger people. Women tend to have more problems with sleeping than men, and for whatever reason, Caucasian people have more trouble with sleeping than other ethnic groups. In addition, there are a number of lifestyle and environment issues that can contribute to insomnia. Things like poor sleeping habits, we'll talk about that some more. Excessive stimulation, in particular, this focuses on brain stimulation. Anxiety, depression, poor coping can all contribute to insomnia, and insomnia can contribute to those as well. And then alcohol intake, which we'll talk a little bit about how to modulate that as well. Other factors that are more related to people with cancer would be the two blocks on the right. And this would include other diseases, things like reflux, pulmonary disease, congestive heart failure, allergies. So many things can contribute to insomnia. People with more advanced cancer tend to be more at risk for insomnia than people with earlier stages. Things like disease-related symptoms like pain, cough, trouble breathing, and fever can all contribute to insomnia. And then on the other hand are the treatment-related symptoms, again, things like pain. And this would be more related to treatment, or symptoms like post-surgical pain is a pretty common one that can contribute to difficulties with sleeping. Nausea and vomiting, fever, again, and hot flashes. And we will definitely be talking a little bit more about how to deal with hot flashes. So in terms of cancer specifically, people do have a number of different reasons why they may have insomnia, and we talked about some of these things in terms of pre-existing sleep problems and cancer treatment-related symptoms. Just another note about depression or anxiety. People who are, even though it seems counterintuitive, people with depression either sleep too much or have trouble sleeping. So that can definitely be a major factor, and not being able to sleep can contribute to anxiety. To depression. And then anxiety, I think it makes sense that people might have trouble sleeping because of all the fears and concerns. There are medications that can contribute to insomnia as well, and these all can cause some degree of stimulation of the central nervous system, making it difficult for your brain to quiet down enough to sleep. And this can include things like corticosteroids, prednisone, Decadron. Anybody who's had steroids before knows that if you take them for more than a couple of days, they can really rev your system up. Some antidepressants can also contribute to insomnia. Primarily the ones like Celexa, Paxil, Prozac, those kinds of antidepressants. Some blood pressure medications can also contribute. And then some non-sedating antihistamines like Zyrtec and Claritin can also contribute to some difficulties with sleeping. So if you have insomnia or other difficulty sleeping and you're taking some of these medications, it would be a good thing to talk to your healthcare provider about to see if maybe you should be taking something different. Insomnia is absolutely annoying. It can really be very bothersome and interfere with your quality of life. But I think many people think of insomnia as something that's just annoying and you just have to deal with it. But the thing to remember with insomnia is it really is something that should be acted upon, because a lack of adequate quality sleep can have a direct impact on physical and mental functioning. And some consequences of insomnia can include excessive daytime sleepiness, especially if you find that when you try and do something, you're consistently nodding off. That can really interfere with your ability to do normal daytime activities. Fatigue and less energy to engage in normal activity. Normal activities, again, are consequences of insomnia. Impaired short-term memory and trouble focusing can be a consequence of not getting enough restorative sleep. You can also have an increased risk of accidents, and a lot of this is because of a lack of mental sharpness that you can have as a consequence of insomnia. But sometimes you can even have some balance issues and some difficulty even picking up your feet enough that you're more at risk for tripping. So that is a concern. low motivation and mood, making it difficult to cope as you usually do, and sometimes it'll exacerbate some of your other issues. Impaired social and work activities, really impaired ability to do social and work activities. And sometimes these things are really important, and if you are not able to function as you normally would, this can be very frustrating and interfere with relationships. And finally, insomnia can actually interfere with immune function, which can increase your risk of infection and can slow healing. So sleep is very essential to normal functioning. There are many ways to assess sleep, but when describing your insomnia and its consequences to your healthcare team, it's essential that you be as descriptive as possible. Different issues can be manifestations of different types of sleep disturbances and can indicate a need for a different intervention. So when a sleep assessment is done, these are the types of things that are typically looked at. How long you actually are sleeping when you're in bed, how long it takes to go to sleep, the number of times you wake up at night, and how long before you go back to sleep. So if you wake up, once during the night and take 3 hours to go back to sleep, that's going to be very detrimental. But even if you wake up more often for shorter periods of time, that still can interfere with your normal sleep cycles. How much do you nap during the day? How often do you fall asleep during the day without trying? And how well you feel when you're sleeping, how well you feel that you're sleeping can all be very important indications of whether the insomnia is a significant problem and whether something needs to be done about it. Other symptoms that your healthcare provider should ask you about are things like anxiety, depression, and fatigue. As we talked about, these are very intertwined with insomnia. And what you do to try and sleep, what works and what doesn't work for you. Okay, sorry, I did check my notes there for a second. So if you have significant sleep disturbances that your healthcare provider is not able to provide effective interventions for, there may be an indication for you to have a more in-depth sleep analysis. And this is particularly an issue for persistent and chronic sleep disturbances. And this, a lot of times, will include a referral to a sleep specialist, but it depends on your healthcare team and how comfortable they are with doing the sleep assessment and making recommendations. One key thing to remember is that sleep is a very individual experience and not easily measured by others. The more detail you can include in your description about your sleep patterns, how it affects your life, and how bothersome it is will provide the most important information to the healthcare provider during the sleep evaluation. And again, emphasizing the fact that it's interfering with your normal daily activities will help the healthcare provider understand just the significance of it. And then for chronic or more severe sleep disturbances, there are some additional tests that can be performed. These include things like a visit to a sleep disorder center, where there would be an in-depth analysis and then perhaps some additional testing, an overnight sleep study to measure your physical movement and brain activity during the night, as well as something called actigraphy. Actigraphy involves wearing a device that's kind of like a watch, and it's along the line of things like the fitness tools that people use, the Fitbits and the other ones that track your activity. And what this will do is it typically looks like a watch, but it will monitor your movements. And it'll do it not just during the daytime, but also at night. And that can also give some clues as to how severe the issues are. So there are a number of things that you can do to help improve your sleep. And excuse me, the goal of any intervention for sleep is to improve the sleep so that you can fall asleep easily, stay asleep during the night, and wake up feeling refreshed and rejuvenated. And the most effective way to deal with insomnia usually involves a combination of techniques. And I do realize that those things can be very difficult to achieve sometimes, but there are some things that can be done. The one thing that has shown the most promise in terms of improving sleep are cognitive behavioral strategies. This includes things like what is called sleep restriction, which basically means that you structure your sleep a little better. You go to bed and get up at the same time every day, and that helps your body start to anticipate when it needs to wind down to go to sleep. And then you want to avoid daytime napping, or if you really feel like you need a nap during the day, try and limit it to 30 to 45 minutes, because daytime napping is something that will very frequently interfere with your ability to go to sleep during your normal times. There's another category of strategies called stimulus control, and this includes things like only going to bed when you feel sleepy. If you go into bed and you lay there awake, instead of just laying there, you should get up and go into another room until you're sleepy, and then you can return back to bed. And then using the bedroom only for sleep and sex, and that helps your body, again, relate your bed and your bedroom with some place to relax and to rest. Other things you want to do in terms of what's called sleep hygiene is things like avoid caffeine in the evening and maintain a comfortable sleep environment. Cool room. Too hot, if your room is too hot, it does tend to interfere with people's ability to sleep. So keeping your room cool with light covers. Fans can be very helpful, both in terms of the movement of the air, but also the sound, it's kind of like white noise. Minimal lighting, trying to have a quiet environment. Soft music or background noise will sometimes help. There actually is some research that shows that people who listen to about 30 minutes of, usually the study was done with classical music, the soothing kind of music can help people wind down and sleep better. So it's something that might be worth trying. And the other thing is to not watch television or use a computer screen in your bedroom. And actually for the half an hour to an hour before you go to bed, try not to do that as well, because the light that comes from the television screen and the computer screen is very stimulating to your brain and can interfere with your ability to wind down and go to sleep. Another thing that is part of cognitive behavioral strategies is cognitive restructuring, and this includes a focus on identifying and changing negative thoughts, beliefs, and fears that interfere with sleep, which basically means figuring out what it is that you are thinking about sleep, and if you are having trouble going to sleep because you're afraid you're not going to be able to go to sleep. Working on changing your attitude so that as opposed to being afraid you're not going to be able to go to sleep, going with a more positive attitude that you'll actually be able to go to sleep. Or if you're afraid you're going to have bad dreams, how you can kind of work on that. And that's something that typically is done with some sort of a counselor. And finally, relaxation techniques are part of these strategies as well. And so the recommendation is to relax for 1 to 2 hours before going to bed and having a bedtime routine, including things like maybe you want to read, listen to music, taking a warm bath or shower. All those things can help ease that transition. And the good thing about these types of interventions is that they may also help improve your mood. If you're having issues with anxiety or depression, they can also improve fatigue and overall quality of life. Physical activity is also very likely to help for people with insomnia. In particular, most of the studies that have been done include moderate intensity walking for 30 minutes, 3 to 5 days a week. And this can be helpful at any point from diagnosis through survivorship. And there are minimal risks for people who engage in moderate intensity activity. There are other types of activities that can be appropriate as well, but that's just where most of the research has been done. And other types of aerobic stretching and strength training can be helpful as well. Anything that helps exert your body to the point where you are changing, where you're getting rid of that excess energy that you may have, that'll help you wind down and go to sleep later in the day. Another thing that's been shown to help is exposure to bright natural light for 20 minutes a day, and especially in the morning. And that not only that, what that really does is it trains your body to realize when it's daytime, and then when the sun goes down, for your body to sense the dark and know that it's time to relax and go to sleep. In addition, stress reduction can be very helpful. Things like mindfulness-based stress reduction, which is a form of meditation, and that has to do with being aware of the present moment. It stresses awareness of your feelings, thoughts, and bodily sensations. That fits with some of the cognitive behavioral therapy or techniques where you become aware of what your issues are, what it is that's concerning you, and then deal with those so they don't kind of fester at the back of your brain. Other types of mindfulness practices can include a body scan, looking for tension in your body, some simple yoga exercises and stretching, and meditation. Yoga can also be very beneficial, either just gentle stretching or more intense yoga if that's something that you have been doing and want to continue. And massage. Massage can be very relaxing. And whether you have an actual massage therapist do that or have your partner do massage for you in the evening, that can be very helpful as well. There are ongoing studies of many other techniques to improve sleep, which might help. But for these other ones, it's not clear just how effective they are and who might be helped from them. But that's mostly a matter of not having enough research done to be able to tell. So things like acupressure, acupuncture, expressive writing, healing touch, mind, body, spirit therapy like Qigong, progressive muscle relaxation, guided imagery, all of these things have been anecdotally found to be beneficial. So if you are interested, you could absolutely pursue something like that. And they all are safe, so I'm not too worried about complications from that. And last but not least, there are a number of medications, and actually quite a few medications, that have been tried to improve sleep in cancer survivors. The main issue with these medications is while they have been tested in the general population, many of them have not been tested enough in cancer survivors to show what's effective and what's not effective. So it's a little hard to know what actually may be best. And when you think about the biochemical changes that can occur in your body from having cancer and getting treated, your response to these types of medications may be a little bit different. When prescribing sleep medications, physicians and other healthcare providers tend to consider a couple of things. And this is where your whole sleep history is important and getting those details, because some of these medications are very short-acting, and they would be helpful for people who have trouble falling asleep. But if you have trouble if your trouble is not falling asleep, it's waking up in the middle of the night or waking up early in the morning, short-acting drugs won't be as effective. And also they're going to want to choose a medication that's less likely to cause daytime sleepiness or problems functioning. So if your problem is falling asleep at night, but you sleep okay after that, they're not going to want to give you something long-acting, because something long-acting can kind of carry over into the next day, so you sort of have a sleeping hangover, and it makes it a little bit harder to kind of get up and get moving and get up to speed in the morning. Also, the medication should not be known to interact with other medications that you're already taking. And many cancer survivors, especially during active treatment, are taking many medications to treat their cancer and to help manage their side effects. So for most prescription and over-the-counter medications, it's important to look at these kind of interactions. So you don't want to take anything over-the-counter. You don't want to take any herbal or complementary therapies without speaking with your healthcare provider, because they would know whether there's any interactions or not. And as listed on here, there are a number of different options that have been tested. Some of the non-benzodiazepines like Amgen, Lunesta, benzodiazepines, which are drugs like Ativan and Xanax and Restoril, antihistamines, especially might be helpful if you have trouble falling asleep. Maybe not, though. They can have other complications. There are drugs called melatonin receptor agonists, which don't tend to be used as often, but may be an option if some of the other medications don't work. And some people have tried melatonin, and again, this is very individual in terms of response to that. Works better for some people than others. So I would now like to turn things over to Colleen to talk a little bit more about some of the nutritional aspects.
Yes, hi. Are you hearing me? My name's, hello?
Yep, we hear you.
Okay. I thought I saw a mute button on my screen, so I wasn't sure. I'm going to pick off where Barb left off, talking a little bit about the role of stress and where nutrition can fit into that, and unfortunately can, if not handled correctly, actually make it worse, and that is not at all our intention. One of the researchers from McGill presented at one point about what are the things that cause us stress in our lives, and use this nut analogy of things that are novel or new to us, things that are unexpected, and that we see as a threat to ourself or to our ego, meaning how we are functioning our role within the family perhaps, or our job, and then things we have a sense of lack of control around. And of course, cancer fits very nicely into all of those things, unfortunately. So many people I see beginning their issues with sleep even before they begin any treatment that might be aggravating it. It's all that initial anxiety before treatment started, and there's a lot of unknowns out there. And I don't ever want to make nutrition be a new stress to them. It can be something that people will focus on as a way of regaining some sense of control, of contributing to their own health plan. And of course, that's very positive and good for patients if it stays at that level. But at times, people can cross the line and be worried about every bite they're putting into their mouth and how it might be impacting them. And at that point, we go into that fight or flight reaction of hormones that are being secreted, and it works against everything we're trying to do. It actually increases blood sugar levels, it decreases sleep, it impacts immune function, and those can all interact with each other as well. As Barbara mentioned, immune function is impacted by inadequate sleep to the extent that they've done some tests showing clinical trials with college students and sleep depriving them to 4 hours of sleep the night before a flu vaccine, and finding that they have only about 50% of the reaction or benefit from the flu vaccine in that kind of a setting. So wherever we're talking about changes for you to make, I always feel like it's important for you to keep your changes empowering to you, not a new stress to you, not something you feel like you have to go out and do 10 different things overnight at once. You're going to be better off focusing on 2 changes. And usually what I'm talking about is nutrition, and we're talking about 1 diet change and 1 exercise change, because I do think exercise is so important in the whole management of stress as a whole, so that people can feel better at night, go to sleep easier, and that's a critical piece of all of this. In terms of nutrition, there are a few things that you can tweak that may actually help you quite a bit in sleeping through the night. One is to try to meet your hydration needs before evening rolls around. We do constantly encourage people to get enough hydration because it affects them so much in terms of their fatigue levels. They feel extremely tired if they have not gotten enough fluids in, and that's the kind of fatigue that's not relieved by sleep necessarily, even if you get it. So we really do want people to have adequate hydration, around 2 quarts a day for most people. We'll talk a little bit about what types of fluids might be better later on. But if you forget to drink during the day and you're trying to make that up at night, you're going to get up to the bathroom all night long, and that is definitely going to interrupt your sleep more. So we do encourage you to pace it if you can through the day. Try to get about 1 quart in through the morning, through lunchtime, another quart in throughout the afternoon, before dinner time, and that way you can ease off at night and you won't be making things worse for you once you do get to sleep. I also find that stabilizing blood sugars with smaller, more frequent meals through the day, usually that translates into maybe 4 times a day that you're trying to eat or drink something. And we definitely encourage you to have some protein as part of those times per day that you're not eating simple carbohydrates by themselves, because otherwise your sugars tend to peak and then can fall on you, and that will leave you feeling like you've run out of energy again. We try to avoid the roller coaster blood sugars that can happen if you're concentrating or mainly falling back on carbs through the day. However, the big exception to that is the evening time, and we've we found with people who were following, say, an Atkins diet or a very low-carb diet, that they fell apart emotionally, for one thing, and often had extreme problems sleeping. And part of that is related to the fact that when your insulin levels are a little higher after you've had some carbohydrates, it pulls away some of the competitors of the other amino acids that are competing for transport into the brain, and it lets tryptophan get into the brain, and it increases your serotonin levels. And so since serotonin is somewhat of a calming agent for us, that's what a lot of the antidepressants are aimed at, is improving serotonin levels and decreasing the breakdown. We really find that if you're struggling to sleep, that maybe if you try having more carbohydrates in the evening, you may find that you will fall asleep quicker, and there's studies that show that that is the case. The what you call it, old wives' tale or whatever that is out there, that warm milk at night is helpful for sleep, has some basis. Milk contains quite a bit of that tryptophan that we're trying to get into the brain, and can help make more of those serotonin again and increase sleep. And the calcium in the milk seems to intensify the effect and the benefit. So those might be something to think about as well. In terms of teas, as drinks or supplements, of course, you're going to want to talk to any of your medical providers about any supplements that you're thinking about taking. But tea itself contains another little piece of protein called L-theanine. It's an amino acid in tea that promotes alpha brainwaves that are linked to relaxation and calming dopamine. And one reason we find that people tolerate tea so much better in terms of anxiety levels, it counters the stimulation of the caffeine content that's in tea, which is already lower than is in, for instance, coffee. And about 4 cups of tea a day is equal to about 100 milligrams of a supplement if you took L-theanine as a supplement. And the recommendation around insomnia for L-theanine is between 100 and 250 milligrams a day. Whenever you take anything, I always recommend you start low and go slow, that you just start and see how it affects you. And if it's benefiting you, you can tweak the dose a little bit. Chamomile also seems to have some benefits that have been tracked down to pigeonin. I may be saying that wrong. It's a flavonoid in chamomile that decreases anxiety and depression, and can help then, of course, if you're not thinking about things that are making you anxious, to go to sleep more easily. The study was done with 220 milligrams of the chamomile extract. The authors weren't really sure how that translated into tea dosing, but chamomile tea at night would be a reasonable thing to be taking if you wanted to try that as a more natural option for you. When we talk about tea, going back to the theanine, people always ask, is it green tea or black tea, or what about this white tea? There's different levels of processing of virtually the same plant. So it's all the same plant. It's just a matter of how it was processed, with less processed versions, the white tea, the green tea, having more catechins, the ECGC you hear about as a benefit in green tea, and the more processed having more of the theaflavins and theorubigens. And so they all have some benefit, and all true tea, meaning it's not an herbal tea, is going to have some of that L-theanine. So that's something that you could think about and consider as an option for yourself. I saw a question that had been written in early on in the text over here, where someone was complaining that their sleep got hijacked and they're not sleeping well, and they think that's contributing to their weight control issues. Absolutely, undeniably true. What we find is that when people don't sleep well, it hijacks your efforts to control your weight in virtually every way you could think of. There's hormones that handle the stimulation of appetite, that tell us maybe we've eaten enough and signals what we call satiety. And when you are sleep deprived, those hormones are going in exactly the opposite direction. So we have more ghrelin, which is going to stimulate appetite, and less leptin, which is going to signal satiety. And it increases intake by about 22% the next day, which translates into about 350 to 500 calories a lot of times for people. On top of that, there's evidence, and again, this is done in young college students without any other issues, to try to sort out as many of those variables as could be. They found that they were able to maintain their blood sugar levels, but it was only at the cost of putting out more insulin to do that. So more insulin was floating around, trying to clear the blood sugars, get those blood sugars cleared, and keeping their glucose levels normal. But when we have more insulin floating around, it's sort of this primitive signal to the body that there's lots of food around, because your insulin levels aren't going to be high if you have no carbohydrate coming in your diet, and it triggers abdominal weight gain. It actually is triggering the body to put away some of what's perceived as excess calories as fat, and so it definitely leads to more of that abdominal weight gain, which unfortunately is kind of this vicious cycle that can also lead to more insulin secretion, and we can get something going there that's not taking you again in the right direction. One of the studies more recently, they looked at restricting people to 5 hours of sleep a night over the course of a work week, and found that those people gained about 2 pounds over that week, because you're much less likely to exercise when you feel very tired. You're much more likely to snack and to seek out high-calorie foods as energy picker-uppers. And again, that is going to be working against any efforts you're making to choose the right foods and try to maintain your weight. And to expand a little bit more on what Barbara mentioned about sleep apnea, we used to think that if you were overweight, it caused the sleep apnea, that just caused your body not to be able to take those breaths regularly through the night, and causing you then to kind of interrupt your sleep by suddenly gasping to come up for air. It's like your body choosing to breathe rather than to stay asleep. And that was the cause of it, was that they were overweight. We always knew that if they lost weight, it helped. We actually now know that if you exercise, it also helps. But it's equally true that if you have sleep apnea, you're likely to gain weight, even if you started out a relatively normal weight, and it's just the architecture of how your palate meets in your mouth and how it obstructs your breathing. There's some genetic components to it. So if you have family members who had it, certainly that might be more of a possibility for you and something you might want to get checked out, because it goes both ways. So hopefully that's something that you don't put off in terms of getting those sleep studies done and finding out if that is something that might assist you if you do some of the interventions that will help with that, like CPAP, masks, and those sorts of things. And GERD, or gastroesophageal reflux disease or heartburn, we're going to talk about later, because that will interrupt your sleep at night as well, and certainly can cause people to not sleep as well. So what happens with heartburn, there's a little diagram here, is that it's supposed to be a one-way trip for your food, that when you eat, it goes down the esophagus and into your stomach, and that valve at the top of the stomach, called the esophageal sphincter, is supposed to close down at that point and prevent your stomach, as it mixes the food with acid and pounds it to try to break it into smaller pieces, that it doesn't flow back up into the esophagus. But there's a few things that will make it more likely for you to have problems with that. And one of them is a hiatal hernia, just a weakening in the diaphragm that is supposed to keep the heart and lungs away from the lower GI tract. But it can sneak up in there and can cause changes in how that valve is able to close. Certainly having more weight seems to press on it and cause more of a potential for that reflux happening. We know smoking and alcohol are problems around that. And some of our patients, depending on what your cancer is and what your issues are, will have some trouble with what we call delayed stomach emptying, which means the food hits your stomach, but it isn't emptying in a pattern that is normal. It sits there longer, usually makes people kind of nauseated, can lead to more weight loss actually, because it feels so uncomfortable with that food sitting there and stretching out the stomach and pushing on that sphincter between the stomach and the esophagus and causing food to flow back up into it, mixed with the acid, which then burns, hence the term heartburn. What we recommend strongly around sleep is that you stop eating 2 or 3 hours before you go to bed. That should give, assuming normal emptying, that should give time for your stomach to empty out and fight against what happens when you go to bed and you basically no longer have gravity on your side. Gravity is not keeping the food down in the stomach. You're laying flat, and it can roll right back up into there. And that's why people have so much more heartburn at night, and will notice and complain about that, and that even waking them from sleep. So if you can slope the bed, I always tell people not so much that you need Velcro pajamas, but if you can put 4-inch blocks under the top of the bed, it will slant it a little bit and help with that gravity issue being more on your side again. Some people will use a wedge between their 2 mattresses, and that will help. You can buy them specifically for this reason. Obviously, if you're having heartburn, you're probably being prescribed an over-the-counter proton pump inhibitor, something like Nexium or Prilosec, or some of them, well, Nexium is not it's not a proton, it's not a over-the-counter product, but some of them have become over-the-counter, like Prevacid and Prilosec, and some of them are prescription. And then H2 blockers, which are all now over-the-counter, but can also be prescription at a higher dose. And both of those basically shut down acid production to various extents in the stomach, so that if you do reflux back up, it at least there's not acid in it. It's not going to be hurting your esophagus and damaging that tissue. So those may be something to explore with your doctor if you haven't mentioned it to them. In terms of the delayed emptying, there are prescription meds that can be useful for that. And you might want to talk to your doctors if you feel like you have that symptom of food just sitting there and not moving along and getting worse through the day. But ginger is one thing that's been studied as an alternative, complementary type of therapy at 500 to 550 milligrams per capsule. And I usually encourage people just to start with 1 a day and then increase it to as many as 3 a day if it's helpful for you. Ginger tea, ginger candies, ginger things, anything that's real ginger can also be used as a substitution and may be helpful for you. But primarily what we want to do is don't have those large late meals, especially if they have more fat in them, because fat slows down emptying in anybody. Your stomach's job to some extent is to take a reading on what's coming down and say, how hard is this to digest? And fat is one of the hardest nutrients to break down and digest. It depends on enzymes coming out of your pancreas, and it generally slows everything down so that as that fat is gradually emptied out of your stomach, it has more of a chance as it goes through your small bowel to be appropriately absorbed. But some of the other things that can cause just issues within your stomach are spicy foods, especially garlic, onion, pepper seem to create more acid secretion. Nuts can actually fall in there as well. Tomato products, citrus, and it isn't so much that they're acidic themselves as how they affect the production of acid within your stomach. Chocolate, caffeine, all of those things can be problematic for some people. So it's a matter of trial and error for yourself as to whether or not any of those things are affecting you. Alcohol, we already mentioned being a problem in this area. And peppermint is something a lot of people don't realize because they will actually take peppermint assuming that it's going to help them with their GI problems because it's known as a kind of soothing type of thing for your GI tract. And that's very true for your lower GI tract. It actually is a muscle relaxant. So if you're having a lot of spasming or problems in your intestines, it can be helpful, but it relaxes that sphincter at the top of the stomach, between the esophagus and the stomach, and people's heartburn can get much, much worse. And so something to stay away from if that is affecting you, because heartburn is well known to wake people up at night and to have them running to find some other medications or something that might control that. And so if we can stay away from that, that will be good for them. We try to limit intake that interferes with sleep in other ways. Alcohol within a couple hours of sleep seems to be problematic. It's really tempting because people will feel somewhat calmed with the alcohol, so they may feel like it will help them get to sleep. But then as their alcohol blood levels fall, it actually turns around and signals the body to wake up, and there's less REM sleep. So overall, it's not a strategy that's going to be useful for you around sleep and could actually make it worse. Certainly can increase that abdominal weight gain just from the calories and can, increase your risk of that reflux and weakening for that reason. On top of that, when people have used certain things for, getting through the day or getting socially at night or whatever the reason is, nicotine from smoking, caffeine, alcohol, when people try to go off of those for very good reasons, there's a period of increased anxiety as they work through that and find new solutions to their anxiety needs and calming needs. So just remember that. It's a good idea, but there's always this period where it seems to get worse before it gets better. Hot, spicy foods, especially in large volumes, one of the things they do is affect temperature regulation, so they can cause problems with what your body perceives as too hot, and hence hot flashes. And certainly they contribute, as we mentioned, to the GERD issues. Caffeine has about a 3 to 11 hour half-life. I think as people are more accustomed to it, it seems to affect them somewhat less, but it does have an impact that they may deny, but it's affecting their ability to sleep, and mostly because it can increase cortisol, which interferes with sleep and actually further increases stress and depression, heart disease risk. I find anxiety is so much part of most of my patients' sleep issues that anything that we can do that can limit that is certainly something that I think we should be working on. There was a poll taken by the National Sleep Foundation and found that about the average for people in the United States in terms of caffeinated beverages is 3 a day. And obviously that's going to be different from one food to the beverage to the next, but quite a bit. And it can take over 48 hours to clear caffeine from your system entirely. So the 3 to 11 hours means that half of it's cleared within that time, but then the rest can take longer to get out of your system. And unfortunately, during that time, you usually get a pretty good headache. Often people coming out of surgery will blame it on the anesthesia, but we often feel that it's probably just caffeine withdrawal, that they've been away from it, and that's really causing their headaches. So be prepared for that as you start to wean your caffeine down, that could happen, and you need to expect it and not feel like something is going wrong. What are some of the other integrative therapies? Integrative, by the name, means to make whole, and so we're assuming that if you are trying any of these other therapies, that you're talking about it with your healthcare team, that everybody knows what's going on and how it might interact with any of your other treatments so that they can make sure that you're making an informed choice around any of these things. But magnesium and calcium are both found to be somewhat helpful for sleep. Magnesium, because if you have a low magnesium, it can actually cause some pretty restless sleep. And I listed some of the foods here that include magnesium. But taking it as a supplement at 200 to 400 milligrams, unless your kidneys aren't great, aren't working well, and aren't able to clear it if it's an excess, is something that may be of benefit to you. Also helps with some things like leg cramps that sometimes will wake people up at night if their levels are low. And calcium is actually needed to help make melatonin. I don't typically recommend more than 500 milligrams of calcium a day. We talked about some of the research around bone density, and that more than that hasn't generally been proven to be that much more beneficial. But 500 milligrams, if you want to time it around night, maybe something that might be beneficial for you there as well. And the great thing, and one of the reasons you see calcium supplements often mixed with magnesium at about half the amount of magnesium for the amount of calcium, is that calcium can tend to be constipating, and magnesium tends to be somewhat a treatment for constipation, as in milk and magnesia. And so that combination tends to avoid the bowel side effects from either one of them if you're doing it at the same time. 5-HTP is, the dosage is usually 50 to 100 milligrams 15 minutes before bed. It's an intermediate in the conversion from tryptophan to serotonin, and so it can be helpful in, again, improving sleep because of that tryptophan in the brain issues that we talked about earlier. Valerian's interesting in that I've seen studies that say it doesn't work at all. I've seen studies that say it does. I think it's an individual thing. But what is pretty universally known is that it takes 2 weeks to really click in. It's not one of those things you take and immediately that night you have better sleep. There can be some GI discomfort with it, and in about 10% of people, they have what we call a paradoxical reaction, and it actually revs them up. So, again, like with anything else, if you start low, you will find out if you're one of those people and not have an extended bad experience with it. But it affects GABA transport into the brain and may have some benefits around that. So, something that some people will try and may or may not find useful for them. The other thing I did want to talk about a little bit more is melatonin. It is a hormone, actually, that's made in our pineal gland, and it helps signal drowsiness and sleep. And it was one of the ways that, it naturally was produced because in the past, historically, we have lived in places where we went to bed at night when it was dark and we got up when it was light, and melatonin is produced during the dark. And is interfered with by light at night. So that may be one of the reasons that screen time before bed is counterproductive for you, that light coming into you is not a good thing. We certainly know that blind people produce more melatonin. The light isn't perceived by their brain and isn't, so they're kind of in that state of more continuous melatonin production. We know people who work shift work have more incidence of breast and prostate cancer. There's actually some data around pathways that melatonin may be useful for in decreasing cancer risk. So there's been studies done out there that used very high doses of melatonin, like 20 milligrams a night, and there's some alternative practitioners that may actually recommend doses along those levels. I feel like you should start much lower than that, somewhere at half a milligram to 1 milligram, maybe go up to 3 milligrams. You take it about 30 minutes before bed. Keep in mind that most people's melatonin levels will normalize with that 0.5 milligrams. That's enough to normalize your levels if you were low. But if you're using it for this purpose, you can use more than that. And some people will actually have a better response to the 2 milligram extended release Other people say it doesn't really make a difference for them. But one of the things that happens is melatonin is actually triggered with a drop in core temperatures as things are cooler, and things are your core temperature is cooler. So taking a bath at night and having that temperature cool from that can help trigger sleep as well. Darkness is essential, so all of what Barbara was talking about with that dark room, really important that is there, that you don't have that light at night that is going to be interfering with it. So the sleep benefits really can vary, among patients, but it seems to improve problems with sleep latency or falling asleep and awakening during the night, may help with some hot flashes. There are all sorts of cautions always threatened around any of these things, and some people have estimated the side effects to about maybe a third of people. Some of them, in my experience, are overestimated. I've actually never heard of an interaction with the SSRIs, but it's theoretically a possibility for them. I know there is issues with people around seizure meds or seizure disorders, and so that's something you should look into. But what most people describe to me is they have more vivid dreams. Some people don't appreciate that. And they can have what a sort of a snooze alarm effect of, not really transitioning to being awake as well, but not really being sedated the next day. So those are all things to sort out for yourself and see if this works for you or not. Sorry, turned it down some in the wrong way. So we go back to treating the cause of what we think is triggering some of our issues with sleep. And it is immensely important for quality of life. I think we very much underestimate how important sleep is for us. But, what we've talked about already today is those small frequent meals and snacks, more stable blood sugars by day, less reflux at night, making choices about your hydration and when you get it during the day, and not having caffeine-containing hydration after about 3 p.m. or alcohol, and then that good sleep hygiene that Barbara mentioned and is so important for all of us. Some of the things I've talked about in more of the complementary realm today is around things that reduce depression and anxiety as their mechanisms. So tea, theanine, chamomile, the aerobic exercise is so important and so beneficial to patients. Over and over, they'll tell me, as long as I get out and walk during the day, I sleep better at night. There certainly are medications, and Barbara reviewed a lot of those. One that we have found perhaps has some benefit is Remeron, which is an old medication that has some advantage around generalized anxiety disorder, has a little bit of sedative properties to it, which is why it helps with sleep. And you might not want to take it if you are struggling with your weight because it actually can increase your appetite. So we use it during treatment where people also need that because it kind of hits a lot of issues that our doctors feel that it might be helpful for. Acupuncture, I think we've mentioned before, meditation, listening to those music or the meditation tapes may be really helpful for you. And I've had a few people tell me that journaling at night and just kind of writing it all down and getting it down on paper can really help them not then continue to think about it at night. So that's always a plus for them. I would agree totally that dealing with any of those other issues that might be aggravating your sleep, like restless leg syndrome, the sleep apnea, pain is so invasive for patients if it's not well controlled. It wakes them up out of sleep or keeps them from going to sleep. And even apart from doing adequate pain control at night, if they're fighting it all day long, they're just exhausted. So I really encourage people to take control of their pain, not let that be something that they're trying to self-manage and be tough. It just has so many ramifications everywhere else for them. So what we're trying to do is avoid the consequences of sleep deprivation for you on your mood, how you're be able to enjoy your family, on your memory, on, Barbara alluded to the delayed response times and the accidents, the safety issues, immune function, your weight, your heart disease risk, and just they've even shown now sleep deprivation causing genetic changes that are associated with aging. So this website, thesleepeducation.com, has great information on it, maybe something that you want to pursue as well. And now I'm going to turn this over to Marsha and let her tell you about her plan. I'm going to move the ball here a second.
Hi, can you hear me?
Yes, we can hear you.
Hi, this is Marsha Burtis. I was diagnosed in July of 2014 with stage 4 metastatic breast cancer. Mine's a type of breast cancer called HER2/neu. A lot of people that are not professionals don't know what the heck that is. It stands for human epidermal growth factor receptor 2, and basically it's an overexpression of a protein found in small amounts in normal breast tissue. Mine was extremely aggressive. I am a grateful recipient of the miracle target drug called Herceptin. The cancer support community of the greater Lehigh Valley, namely Jen Sinclair, opened their doors and their hearts to me. I didn't have anywhere to go. I didn't know what to do. I was overwhelmed because I knew too much. I was a nurse for 25 years. I was afforded an opportunity to find a place of comfort, friendship, and knowledge. I attend many classes at the Allentown, Pennsylvania Center, such as jewelry making, Tai Chi, and an ongoing group seminar led by Carol Moritz, PhD, on topics such as fearlessness, sleeplessness, and the power of presence. These groups have been extremely helpful in facilitating a more healthy way of living and thinking. I have a lot of challenges. The things that keep me awake, turning off my mind at night in order to reduce the stress, creating my new normal while trying to preserve the essence of who I am, living every day with the knowledge of my diagnosis and the fact that it is incurable, and recreating a life with pleasures, happiness, and things that ensure a good night's rest. How the heck do I cope? Well, here are some examples of how I've learned to cope. I turn down the world. I make my environment conducive to sleep, as the ladies previously mentioned. You have to make it conducive to sleep. I keep the stress low before going to sleep. I don't watch anything upsetting on TV, no arguing, and I do not exert myself before going to bed. I don't eat anything heavy or spicy, no matter how tempting it may be. Just a light snack, graham crackers help, a little milk. And I do all my business dealings, such as paying bills, making appointments, all junk I have to do for my husband, in the morning. My sleep environment. I surround myself with things that please me, such as a special blanket, lavender scents. I do love the scent of lavender, a satin pillowcase, and I use a sleep mask to block out light. Even a little bit of light coming from the little tiny box on my television, it emits a little light even after it's turned off. The sleep mask takes care of that. And quiet. Quiet, as the ladies have said previously, quiet and cool. My husband keeps that fan on all year round. He'd keep the air conditioner on in the winter if he could. Quiet, dark, and cool. Absolutely agree with you. What I've learned. Well, I learned in taking Carol's class that I get up in the middle of the night and I say to myself, okay, I'm safe. My upstairs brain keeps saying, no, you're not, no, you're not. You have cancer, you have cancer. But I have to keep reminding myself, I'm safe, I'm at home, I'm in my own home, and I can control my environment. I can control or interrupt my thoughts by use of techniques that I've been taught. I use distraction. I might get out of bed, and I have done this, and do something so mundane, such as sharpening eyeliner pencils in my spare room. I clean the jars and the cases on my makeup table with one of those little cloths that you get to clean off your makeup. I find little stupid little things that interrupt my thought process. I interrupt fearful thoughts by reaching for some lotion at the bedside and massaging the pressure point, such as the space between my thumb and my forefinger or the arch of my foot. I use deep breathing techniques that I learn in Tai Chi, and Tai Chi is a real wonderful thing to clear your mind out, because when you're taking Tai Chi, your mind cannot focus on anything except what you're doing. It's wonderful. And when I use the deep breathing techniques, I was taught to count, close my eyes and count. 1, 2, 3 in, 1, 2, 3 out. And that's a distraction. It works wonderfully. My favorite tried and true technique is one that I made up myself. I call it clean slate. I imagine my mind a blackboard, the old-fashioned slate kind. My head is the eraser. I close my eyes and very slowly move my head from side to side, and I erase all the garbage on the blackboard until it's clean. I thank you very much, and I hope that my thoughts have helped someone else.
Thank you, Marsha, and thank you, Barb and Colleen, for your presentations as well. So at this point, I am going to open up the presentation to the audience. Again, like I said in the beginning, if you'd like to ask a question, please feel free to do so and submit it through the Q&A box, which is found on the right of your screen. I'll give it a couple of seconds here, and we will start the Q&A session. Okay, we have a question here. It says, Colleen or Barb, feel free to jump in. How many hours should a person sleep per night? Is there a set number, or does it depend on the person?
Oh, this is Barb. I'll jump in. There really is not a set amount. And if you even look at the average person, there is so much variability. It really depends on what you personally need to feel refreshed. And I have, seen recommendations that when you're at a point where you're not sleep deprived, you go to sleep and see what time you wake up. And if you feel okay with that, that's fine. So, I know I need 8 hours. My husband needs 6. So it's very, very individual.
I would agree. This is Colleen. But I have seen 7 to 8 being recommended. And advised. Certainly less than 6, I think, would be a little risky in terms of the side effects.
Great, thank you. We have a question here on sleep apnea. It says, if left untreated, what are the effects of sleep apnea?
Go ahead, Colleen. You want to jump in?
No, you go ahead. No, you go ahead.
Okay. Sleep apnea causes an absence of or a decrease in oxygen. So if not treated, what can happen is you can, in particular, develop heart problems. People who don't get enough oxygen can have brain damage, have heart attacks. It can be very serious. So it absolutely should be treated. People with sleep apnea who don't get treated have a significantly higher chance of death during sleep than people who get treated.
Great, thank you. We have a question here about exercise. It says, is it bad to exercise right before bed, even if it's a very light amount of exercise?
I think.
Yeah, go ahead.
No, okay. This is Colleen. I've seen a lot of those, advice that you don't sleep, you don't exercise right before bed because it might kind of just activate you too much and not have you fall asleep. But I think it's so individual for people. So I think you look and see if that is something that will affect you or not. In general, I think exercise is good whenever you can fit it in, and certainly not a reason to skip it because it's too close to bed, but maybe keep it a little less than, something that's super exciting or something like that.
Right.
But what is your take, Barbara?
Yeah, I agree. I think that it wouldn't be what you don't really want to do is exert yourself to the point where you're short of breath and your heart's beating really fast, because it can take hours to come down from that because of the chemicals that are emitted from your body. But if you're doing something like stretching yoga that you find relaxing, I don't know that would be a problem at all.
Great, thank you. We have a comment here. It says, I take melatonin. Sometimes, however, I awaken around 3 or 4 a.m. and cannot get back to sleep. Any suggestions or some background information on why that is?
This is Colleen. I've seen some recommendations that you can go ahead and take a little more at that point. You obviously don't want to have it run in too much into the next day. But I suspect that you may need a combination of things to help you with getting to sleep and then staying asleep. But usually I see recommendations that say if you can't get back to sleep, get out of bed, go do something else, and then go back and try again. Any comments, Barb?
No, I agree with that. I think the thing to remember is that there are different medications that help in different ways, and melatonin is designed to more normalize your hormonal fluctuations, so it may not be helpful in the middle of the night. But I also agree that trying a little bit more or maybe taking a little bit more before bedtime as well might be helpful. It's a matter of kind of trial and error.
Mm-hmm. Okay.
And I think part of the problem is there's not a lot of research that says this is the way you should take it.
Mm-hmm. Great. We have a comment here. It says, I have burning hot flashes due to being on Arimidex, which keeps me awake, and was told that I could not take melatonin as it conflicts with my medication. Is there something else I can take for relief as they wake me up and can't get back to sleep?
Barb, have you heard about it?
Are you getting treated at all for, I guess the question is if you're getting treated at all for hot flashes or not. It's possible that an antidepressant might help, because that might help manage the hot flashes, especially to some degree. I would have to look and see about a drug interaction. I'm not sure how they're both metabolized. Do you know, Colleen?
Our next session is on hormones and hormone issues and things like that. So I kind of deferred much discussion about hot flashes to that point, to discuss it then. But I do know that antidepressants, short of estrogen, which of course we don't recommend with breast cancer, short of estrogen, the medications for antidepressants have shown a 50-60% reduction in hot flashes. But if you're on tamoxifen, there are some interactions with drugs with some of the antidepressants. So SSRIs would not be appropriate because they interact with they make your tamoxifen less effective. So all of our patients are put onto like Effexor or something related to that as a choice for antidepressants to help with hot flashes. Gabapentin's another thing that seems to help with hot flashes that was just sort of discovered accidentally. People were on it and therefore their hot flashes were less. And So if you have a reason for pain control with the gabapentin, that's something else that works. And we'll be talking a lot more about strategies for that next session, but all of the same things in terms of hot flashes, smaller meals, not such a big meal at night, the cool bath at night, all of those things actually also help with hot flashes. And we recommend those sorts of interventions for people. The antidepressants are clearly have the most decrease in hot flash frequency, apart from estrogen, as far as I know.
Okay. We have another question on exercise. It says, I exercise even when I'm exhausted. Someone mentioned that I should get electrolytes in liquid. Is this something that you would recommend?
I assume that's for me, Colleen. I only recommend the electrolytes in liquid if you have losses of like diarrhea or vomiting, where you're losing those electrolytes. You're not getting a chance to absorb them well. Generally, apart from that, they aren't necessarily beneficial, which isn't to say you can't drink Gatorade and things like that as an option for your fluids, but unless your losses are related, unless your dehydration or issues are related to diarrhea losses, vomiting losses, we don't come out and say, yes, you should definitely do that and have the electrolytes in it.
Great. And then a comment here, it says, Colleen, I don't know if you want to comment on this. Any comment on sugar's role, if any, in cancer expansion?
Yeah, I can definitely comment on that. But there's a lot of misinformation out there. It kind of starts with the PET scans that use radioactively labeled sugars, and they go to areas where there's a lot of metabolism, and so they light up in areas of cancer. And so the logical translation for someone in the lay public really feels like, oh, then sugar is directly feeding the tumor. I will tell you that sugar feeds every cell in your body, and that we have to maintain stable blood sugar levels. And if you don't eat carbohydrate at all, your body is going to take protein and convert it, because it's essential enough to life to have that have to happen. I've actually written an article on does sugar feed the tumor. It's like 11 pages long that's on our Oncology Nutrition Practice website that you can access. If you go to oncologynutrition.org and look at foods that fight cancer and look for sugar and tumor, that whole article is there. And it goes through the fact that it's not really sugar that we're as concerned about as having problems handling how much sugar you get in, and therefore requiring more insulin to be put out to handle it. As I mentioned, insulin is kind of a signal of having enough calories around, and so it's a signal that it's okay to like have babies or to grow, that kind of thing. Cancer cells can have more of those receptors that might respond to that as a growth signal. So we're really looking at, do you have a problem with insulin to begin with? Are you pre-diabetic? Do you have family history of diabetes? Are you having a problem handling your blood sugars that are requiring you to put out too much insulin? And bottom line, if you just fly under the radar by doing those small, frequent meals that are mixed with protein, you aren't going to be elevating your blood sugars as much, and that's really, something that you can feel pretty confident about doing, that you're going to be okay with that.
Thanks, Colleen. So if you have any other questions, again, this is Rhea, if you could submit them through the Q&A box. I'll give it a couple more seconds. Okay, so we have one question here. It says, I take melatonin to help me get to sleep and stay asleep, but I wake up with dry mouth due to taking Lyrica, but I'm able to get back to sleep after rinsing with biotin. Is this a sufficient way to deal with the insomnia?
the waking up because of the dry mouth is something I hear a lot from, certainly from my head and neck patients, where we've radiated that area. And there's not a lot of great solutions for it. Maybe Barb knows of some other ones. So I've had a few people tell me they actually put a little bit of like olive oil or something on their mouth at night. It keeps their mouth from like sticking to their roof of their mouth, their tongue from sticking to the roof of their mouth by the time the night's over. But many people will just wake up, drink a little bit of fluid, do the biotin, which is a non-alcohol product, which a lot of head and neck patients will use, and go back, as long as they're able to go back to sleep. I'm not sure that's entirely preventable, but maybe Barb has some other ideas.
No, I think that you're right on with that, Colleen. I think that as long as you're able to go back to sleep, I think that that's the thing. Adding more medications in is probably not a great idea. So, I mean, you could potentially try something more long-acting in terms of sleep, but the problem with that then is, it's adding another medication in, and I would only recommend that if you weren't able to go back to sleep. So I think you're doing a good job the way you're doing it.
Okay.
Agreed.
Well, thank you, everyone, for your questions, and thank you to our panelists for answering them. I just want to, Colleen mentioned this a little bit, but next week we will be hosting our webinar on coping with hormone therapy side effects. So if you have not already and would like to register for this webinar, you can do so on our website, which is listed on that slide, cancersupportcommunity.org/webinars. I also wanted to mention that this webinar is being recorded and will be available on the website on the same link that is listed on this slide, and we will also send slides out once they are available. I'll send them out to all those who registered. This slide just lists some additional resources. If you would like more information, you can reach out to the Cancer Support Community, the Oncology Nursing Society, and the American Institute for Cancer Research. Again, we'd like to thank our wonderful speakers, Barbara, Colleen, and Marsha, for contributing their time and sharing this important information with us. We'd also like to thank our program sponsors, Amgen, Astellas, Lilly, and Tesaro. You will now be redirected to our post-webinar survey. We appreciate any feedback that you may have for us. Thank you so much, and have a great night.